Whilst it is not possible to entirely prevent cancer, it is possible to reduce the risk factors for getting a bowel cancer, which are mainly by changing lifestyle factors. So there are simple things that can be done to try and reduce the risk of getting a bowel cancer. Lifestyle choices such as alcohol and tobacco consumption, obesity, and a lack of exercise all seem to contribute to an increased risk of bowel cancer. It therefore seems prudent if we can modify one's diet by increasing the amount of fruit and vegetables, reducing the intake of red and processed meat, reduce consumption of alcohol, and stop smoking, as well as improving our exercise levels. Another way of reducing the risk is having a proactive approach to investigating bowel cancer symptoms. If you have symptoms, you must see your GP. And if you have a colonoscopy early on, there are two possible outcomes that can be beneficial. Any polyps that are detected at the time of a colonoscopy can be removed doing two things. One is removing the polyp and stop it turning into a cancer. And secondly, this identifies individuals at risk of developing further polyps, and this allows for further surveillance and colonoscopies in the future so that nothing else develops. There are some polyps that will never form a cancer, but their mere presence indicates that a patient is at a higher risk of developing a cancer and therefore needs to be put in a surveillance program. It's important to note that most bowel polyps don't cause any symptoms, although some larger polyps may cause rectal bleeding when passing stools. Other risk factors cannot be avoided, such as your genetic background. An awareness of genetics and family history can help take precautionary measures to prevent the development of a bowel cancer. So if people with a family history of a bowel cancer or confirmed hereditary conditions such as FAP or Lynch that are linked to bowel cancer, and those with long-standing inflammatory bowel disease are placed in a regular surveillance program, we know we can reduce the risk and burden of bowel cancer to the population. Despite efforts to reduce individual risk factors, cancers can still occur. Cancer screening tests are an effective way of detecting early signs of cancer, so treatment can start as soon as possible and help to increase the chance of a successful outcome.